The confusion that started inside Kenyatta National Hospital's theatre, where the head of the wrong patient was opened for brain surgery, is far from over. Just yesterday, Health Cabinet Secretary Kericho stated after allegedly visiting both patients that their conditions had improved remarkably.
Fortunately, the second patient is stable. He didn't go through surgery. He's been put on treatment. He's under watch and is also stable.
But a family in Nzoia now claims their son, 25-year-old Angelo Miano, has succumbed to head injuries sustained from a motorbike accident for which the botched surgery had been prescribed to remove a blood clot.
Baadaye ilikuja kutokea kumbe yule mtu angepelekwa theater ilikuwa ni Angelos. So alipeleka the wrong person kule theater.
Citizen TV has not independently ascertained the identity of the patients involved in the mishap, as the hospital shielded them from the media, granting access only to the health CS. The second-year Nairobi University student's portrait now puts a face to the mystery that appears to deepen by the day.
Kwenda huko akatuambia Angelo hawezi kufanyia operation. Nikauliza kwa nini, nimesign form na ilikuwa pelekwa akabecho kile kitu shida imetokea wapi. Akatuambia hiyo shida Angelos brain imekuwa so compressed ya kwamba imekuwa damaged beyond, haiwezi kurekebika and the body cannot be reversed.
Nilikuwa ninatarajia tumia noma. Alikuwa mtoto mzuri, mtoto mnyenyekevu, mtoto anapenda kusoma. Urudago dhaidhare olema kama ungenisikia tu.
It's a mess that threatens to divide the medical fraternity, with nurses feeling unduly singled out for a mistake which calls for collective responsibility.
I'm sorry to say, if the nurse puts a label on a cow and then wheels that cow to theater, will the surgeon just operate on that cow? No.
No professional, including the doctors involved in this event, be condemned unheard and without regard to due process.
At KNH, the hospital's board began its sittings today, as directed by the Health Cabinet Secretary. This as Kericho legislators cried foul over the suspension of the facility's CEO Lilly Koros.
If you look at what has been happening at Kenyatta National Hospital in the last few weeks and months, you're able to read a well-choreographed scheme by well-placed individuals who want to tarnish the name of Madam Lilly Koros and paint her as someone who does not understand the management of such an institution, so as to pave way for racketeers and entrepreneurs who want to do business at KNH.
The road in Kenyatta is institutional. It is not about one or two people. And if it was in the spirit of collective responsibility, it is very clear that the buck stops with the minister and not the CEO.
We don't want Lilly Koros being a victim of the vultures and cartels on the prowl.
KNH is expected to furnish the Kenya Medical Practitioners and Dentists Board with a comprehensive report ahead of the inquiry. Citizen Weekend.